Hello everyone, thank you so much for joining me today on this live video. So today I'm going to be talking about a lot of things in relation to biomedical science. I'll be answering some questions. I've got my list of questions here, so I'll just be going through them, and I hope that I'll be able to answer as many questions as possible. Thank you so much for coming. Thank you for your time. If you can just let me know where you're from, and if you're a biomedical scientist, if you're looking to become a biomedical scientist, just let me know. And as I go on, I'll try and interact with as many people as possible. Thank you very much. So my first question here is about who a biomedical scientist is. So, a biomedical scientist is an healthcare professional whose main role is to investigate the biology of disease, to carry out tests, to find out why diseases are occurring, while people are sick, and they also do research into understanding how these diseases occur and how the diseases are progressing. They help the doctors or the health other health professionals to find out about diseases in people while they're sick. What could cause their disease? Is it genetic related? Is it related to any other factors? And also help them to assess the type of treatment that they might undergo, and also monitor this type of treatment. So the biomedical scientist is quite a useful role in the medical field in assessing patient for diseases, helping deciding on the appropriate treatment plan, and also helping to monitor the disease progress, um, whether they are responding to treatment or if there's a need to change the treatment. So the biomedical scientist is quite a paramount professional in the medical field. So how to become a biomedical scientist in the UK? So the main thing to become a biomedical scientist in the UK is to study a biomedical science degree. That's the easiest method. There are other methods that people become a biomedical scientist, maybe studying like biotechnology, and they find their way back to becoming a biomedical scientist. But the most straightforward way is to get a degree in biomedical science, and that degree is important for it to be accredited by the Biomedical Scientist Institute, which is the IBMS, Institute of Biomedical Science. This Institute of Biomedical Science will make sure that everything you're being taught in your degree is acceptable for HCPC registration. So that is quite important. Hi, thank you so much for joining, Red Boy. Thank you so much for joining. Thank you for coming online. Thank you, everyone. Um, so the second point is to complete a clinical laboratory placement. That is something that you need to do in an IBMS accredited lab. So each laboratory has to meet a standard for them to be able to train people. So they have to have like a training manager, have enough facilities available for them to be able to train individuals. So they are able to get this IBMS status, then they are able to train people or students. So the first one is to get your degree from an IBMS accredited university. Then you need to go for some training, and when you go for this training, you'll be able to register with the HCPC. So those are the main three steps to register as to work as a biomedical scientist. Hi Sharon, thank you so much for coming. So what should I do in high school to study for biomedical science in the university? So usually it differs from one university to another. The university you go to would have their prerequisite, but the main requirements would be for you to study biology, have a levels usually in biology, in chemistry, and also physics and maths is quite useful. If you're an international student, you might be required to have an international English language test. That might be a part of your requirement to study. Then the last thing is just for you to get exposure. You need to get involved, maybe go for science fair, ask for opportunities to volunteer, and that would be able to give you exposure in what it means to be a biomedical scientist. So what should you consider when choosing a university to study your biomedical science degree? The main thing you need to consider will be for the degree to be IBMS accredited. That is quite important because when you're trying to register for your HCPC registration, the requirements you need to meet would involve having a degree that is IBMS accredited. So the second thing would be to make sure that the city that you're going to stay, you really like this city. Is it a city that you would love to spend maybe the next 3 or 4 years in? And also, can you afford to live in this city? Is it close to your family? Do you have a support network? Is it expensive? If you're going to study in a city like London, it will be quite expensive, but you could consider other cities outside London where the rent is cheaper, where you could afford. So those are the things you would consider. And also just to make sure that you would enjoy the program. Those are the things you need to consider when choosing a university. So when you apply to study for biomedical science degree, what do you learn in a biomedical science degree? So it's basically everything you need to get trained to perform tests in a laboratory. So you have to do things that like anatomy, there's physiology, pathology, immunology, there's clinical microbiology, there's just a combination of courses that the IBMS have put in place to ensure that every university has a standard whereby the student needs to meet. So you need to study for this, and if your degree is not accredited, there may be elements in these courses that will be missing. So that is why it's quite important that when you apply to study in a university, check out their status, their IBMS status, so that when you come out of the university, you'll be able to use this degree to work in the laboratory or to get your HCPC registration. Next question is, how long does it take to become a biomedical scientist? So the information I'm giving is relating to how to become a biomedical scientist in the UK. If you are not from the UK, your plan might be different. How long it takes or what you need to study might be different. So in the UK, a biomedical science degree is usually 3 or 4 years. The 3 years degree is one that allows you to just study your basic sciences. Then after that, you have to look for a place to do your IBMS training, your competency training. That's a 3-year degree. Then the 4-year degree is usually a degree that has a year where you would go into the lab to study, and that would be a longer 4-year program. But after this, the main thing is for your degree to be accredited and for you to be able to complete your laboratory training. So how long it takes depends on the degree you're going for. Go for the 3 years degree, you get your degree, then you look for your training. But if you go for the 4-year training, you come out fully qualified, ready to register with the HCPC. So if you go for the 3 years, it might take a while for you to get a job that will allow you to work and get trained to get your HCPC. But for the 4 years, it's quite quicker. You get your HCPC and you start registering. So the route you take will depend on your training, how quickly you get your training also. So that is how long it takes for you to be a biomedical scientist. So what does a day-to-day activity of a biomedical scientist entail? A biomedical scientist can practice in several fields. We have histology, pathology, clinical chemistry. So the day-to-day of each will differ from one to another. So, but the main role of a biomedical scientist is to carry out laboratory tests, to carry out research, to help the doctors to find out why the patients are sick and the appropriate treatment that would be useful for this patient. So basically, doctors will order their lab test. The biomedical scientist, whether it's a tissue biopsy or a blood sample, the biomedical scientist will examine this tissue or will examine this blood, and they will be able to generate a result for the doctor. Then the doctor would evaluate these results and be able to decide, okay, this is what is going on with this patient. This is a test I need to this is the treatment plan I need to have for this patient. So that is where the role of a BAMS is important. They help the doctors to find out what is going on and also give them idea of what they can do to treat the patients. The next question is, what is IBMS? So IBMS is called the Institute of Biomedical Science. It is just a body that is in place to make sure that everybody that is going to be a biomedical scientist is trained at a standard that would allow them to practice efficiently. So it's to ensure that no matter where you come from, no matter the university you attend, no matter the country you're from, you have a standard to meet, and the public would be rest assured that everyone that is in the lab to carry out this test, they are able to carry out this test because they've been trained to a particular standard. So for a university to have an IBMS accreditation, they would have to go through the syllabus and make sure that whatever they are teaching their students is what a general BMS from any university should be aware of. So that is why the IBMS is in place. So how do you register with the IBMS? So for you to register with the IBMS is just for you to go online, check their registration requirements, and just fulfill the registration requirement. But the registration you need will depend on who you are. So as a student, you can just register as an associate for if you qualify and you've also not obtained your certificate of competency, then you are an associate of the Biomedical Science Institute. If you're qualified, you've got your competency, then you'll be a licensate. That's the next level for IBMS registration. When you become a member, to become a member, you will need to have like a specialist portfolio, like a band 6. Then to be a fellow, you need to have a master's. So there are grades to IBMS registration. But all you have to do is just to go online, check the membership you need to register for, and just submit your degree and your transcript and everything. Then that should be pretty straightforward for you to register. So what is the IBMS certificate of competency and how do I get it? So the IBMS certificate of competency is just a certificate you obtain to show that you're a competent biomedical scientist. How you obtain that would mean that you've studied a degree in biomedical science, and also you've been trained for at least a year or more in a accredited laboratory. So these two criteria are what you need to meet for you to be able to get a certificate of competency. This certificate of competence is important for you to register with the HCPC. Without this, it would not be easy for you to register with the HCPC. So the next question is, how can I complete the IBMS certificate of competence? As I said earlier, for you to complete it, you need to have like a clinical placement in an HCPC lab. In the lab, you would have like a training manager who will apply for a portfolio for you, which is more just like a booklet of questions you need to answer, evidences you need to gather. And after that, you will have an IBMS examiner that will come into the lab. They will ask you questions. They will ask you questions just to make sure that what you've included in the portfolio are actually things that you can do. So this is a straightforward step. As far as you have your evidences gathered, you're able to prove that I am worthy enough to be called a biomedical scientist. Thank you everyone that is joining. Thank you very much. I'm going through the questions one by one. So hopefully I'll be able to cover as much as possible. So the next question is, what is the IBMS accreditation and how important is it? So the IBMS accreditation is just to ensure that every degree obtained is at a standard which qualifies you to be a biomedical science. So it confirms that everything that each student has been taught is adequate for them to become a biomedical scientist. They also need this competency for them to be registered with the HCPC. Also, most employers prefer biomedical scientists that have trained in IBMS accredited universities, or that because they know that they've met a particular standard. So IBMS is quite important. IBMS accreditation is quite important. If you need to study a degree in on biomedical sciences, make sure that your university has this degree accreditation, so that you will know that the degree you're coming out with is sufficient for you to work as a biomedical scientist. You don't want to go through the process of learning and studying, and when you come out or when you graduate, you won't be able to work as a biomedical scientist just because your degree is not accredited. There are 56 universities currently in the UK that got accredited degree. So all you have to do is just to go to the IBMS website. There's a website where you can check for each degree. There's a list. So just make sure that every university, any university you're applying to is on that list. So that gives you a guarantee that whatever degree you're coming out with would be useful for you to apply for HCPC registration. The next question is, what can I do if my degree is not accredited by IBMS? So the main thing to do, the first thing to do would be to contact the IBMS, explain to them what your situation is. Like, you've got a degree, it might not be in biomedical science, it might be in microbiology or something similar. So what they would do, they would be to examine your degree, find out the lapses in your degree, and just advise you on what to do. But mainly what they will tell you to do is to go for top-up degrees. This would require you to study further. Usually you have to go back to uni to complete some modules. Maybe your degree is missing, maybe pathology or anatomy. They will advise you to go back to uni and study that. So you should be able to do that in a period of a year or 2 years, depending on how much time you have to complete these modules. So that's usually what you will do. You have to go back to the uni and top up your degree. After that, you get your certificate of competency. Then after that, you can register with the HCPC. So what is HCPC? HCPC is just a body that monitors a range of professionals in the UK, of which biomedical science is one. There are other about 16 or so professions that the HCPC monitor. So it's just to set a standard for all these professions, so that everyone that is coming to the profession have to meet this standard. And this standard are usually standard of proficiency, of ethics on how you behave or how you present yourself to the public. There's like 4 standards that you need to meet for you to be HCPC registered. At the end of your registration, you are included into a register. This register is public, so anybody can go online and check your registration to make sure that you're registered. And if you're applying for a job and you are meant to be on the if you're applying for an HCPC job, your recruiters could go online and check that you're actually registered with the HCPC. So that's why the HCPC there is in place, to make sure that everyone working or claiming the title of a biomedical scientist is actually qualified enough to become a biomedical scientist. So how do you register with HCPC? So there are standards you need to meet, and these standards are usually like 4 in number. But the first thing is for you to complete an IBMS accredited degree. An IBMS accredited degree usually in biomedical science. If it is not, then you have to top up. Then the next thing is for you to complete the training, which is going to take maybe a year or more. When you complete your training, you have a certificate of competency. Once you have those two, then you can apply for HCPC. By applying for HCPC, you should have met the standard of conduct, performance, and ethic. That is usually based on how you present yourself to the public, just a general behavior as a professional. Then you have to meet the standard of proficiency, which is more about your scope of practice, ability to ask for help when you need it. There's a lot of information on the HCPC website for this, but these are just standards that you need to meet. Then there's a standard for continued professional development, just to show that you're improving your knowledge in this field. And the last one is the standard relevant to training and education, where your IBMS training will come in, just to show that you're adequately trained to have your HCPC registration. So those are the 3 things you need to have to be HCPC registered: your IBMS degree, your IBMS competency portfolio, then meeting all these 4 standards for HCPC. After that, then you can be fully fledged biomedical scientist, and you could be included in the register for biomedical scientists. So the next question is, do I need HCPC registration if I intend to work in private hospital or industry? So to work in private hospital, you usually would require an IBMS HCPC registration, because anyone that deals with human tissue, anyone that deals with diagnosis of diseases, anyone that has anything to do with working in the lab, working in the medical field, working with humans, you need the HCPC registration. But to work in the industry, most employers don't require that because you're probably carrying out research, or you're probably into something that does not involve that your work does not directly have impact on humans. So it depends. In the private lab, working with humans, it's needed. In industry, in biotechnology or anything like that, then you don't really need the HCPC registration. Next question is biomedical science same as medicine? No, biomedical science, it is not the same as medicine. Medicine is when you work with humans, you have human contact, then you're able to treat them, you communicate with your patient. But biomedical scientists usually work in the laboratory where you just receive your specimen, you make your lab, you carry out your test, and also you just provide the result. So the doctors do the patient facing, while the biomedical scientists usually work behind the scene. How is biomedical science different from biotechnology or biomedical engineering? So, as I said earlier, biomedical science is focused on understanding diseases, on diagnosing diseases, on working alongside with doctors to find to solve problems in relation to diseases and patient management. Biotechnology is usually involved in like agriculture or food production or anything that is not directly involved with patients, while biomedical engineering is usually involving development of medical devices, making sure that the biomedical scientists have all the instruments that they need to carry out their job as a biomedical scientist. What skill do I need to become a biomedical scientist? So the skills you generally need will just be laboratory skills, ability to carry out laboratory procedures while following adequate standard operating procedures. That is quite important because everything we do in the lab, there are guiding principles. You should be able to follow these principles adequately. You should be able to communicate effectively, work in a team. You should have good communication, good team working spirit. You should be flexible. You should have the ability to work a lot of instruments. Usually, you would need to employ some mathematics, maybe calculating your reagents, concentration, and stuff like that. So there's a wide range of skills you need to have to become a biomedical scientist. You should be able to use your initiative because there are times maybe you might need to work alone, or there might times where you need to make decisions. So you should be able to use your initiative. You should be able to work under pressure. It's usually a fast-paced environment because the doctors are waiting, the patients are waiting. So you need to be able to work under pressure. You need to be able to make decisions at a go so that there's no delay in the patient treatment and the overall procedures of the lab in general. Thank you so much, everyone that is joining. You're welcome. So what is the career path for biomedical science? Or if I'm a biomedical scientist, what is my career path going to look like? So the first stage is usually as an entry level. You've completed your biomedical science degree. You've got your IBMS portfolio access. You've got your HCPC registration. So that makes you a biomedical scientist. This is when you're fully fledged to work anywhere as a biomedical scientist. Then after that, you could go for a specialist biomedical scientist post. This usually require you to have a specialist portfolio. So that means you have to have studied in depth in a particular field. While the generic portfolio is can be in any field, but the first specialist portfolio you need to have taken more time to specialize in a field. After that, you can become a specialist biomedical scientist. Following that, you could go for extended practice diplomas, you could go for a master's that will qualify you to become a senior biomedical scientist. So you usually have a leadership role. You will probably be responsible to manage a section of the laboratory. So it requires some management training, some leadership training that would make you suitable for a role of a senior biomedical scientist. Then there's a another role called the advanced practitioner. These are people that are probably specialized for that. I trained in histology, so someone that is an advanced practitioner would probably have trained to do more advanced procedures like dissection, and maybe to have a proper in-depth in like ICC or other specialized parts of the laboratory. So this is when you'll be able to you need to have studied further to be an advanced biomedical scientist. The next question is, can I work internationally as a biomedical scientist? So if you're trained in the UK as a biomedical scientist, you can work outside the UK, or if you're trained outside the UK, you can work in the UK, but you just have to make sure that you meet the standards. So each country has their licensing requirement. They have the way they recognize their credentials or their qualification. So all you have to do is just to make sure that whatever country you want to work in, you meet their standard. And once you meet their standard, you're able to work in the country. In the UK, the main thing is to have your IBMS degree accredited. If you didn't study in the UK, have your HCPC registration, then you should be good to go looking for jobs. Sometimes laboratory experience is required, but it's something you could find your way on how to get that. So the next question is, what can I do if I am trained outside of the UK? So what you do if you're trained outside of the UK is, first of all, to contact the IBMS. Let them assess your degree. Let them find out what the lapses are in your degree. Then if you need to, if your degree equates that of the UK, then you can apply for HCPC registration. But if there are lapses, they will be able to tell you what to do for you to know, for you to register with the HCPC. Then for you to apply for the HCPC, there's an international route that you need to go through. So that will involve you submitting your evidences. It would involve you giving them your certificates and transcript. They would have to also check your English language proficiency. So with that, with the HCPC, you should be able to register once they have all your evidence. Then if you need to go for top-ups, then IBMS will be able to advise you. They'll be able to help you in any way they can. But the main thing is get your degree assessed, then follow that with your HCPC registration and all the paperwork you need to be submitted going via the international applicant route. So the next question is, what is the future of biomedical science? So a lot of people are just wondering if there is a need to become a biomedical scientist nowadays. But the future of biomedical scientists is really quite good. With the way things are going, there's going to be more of personalized medicine, precision medicine, which will require a lot of input of biomedical scientists. There would be more advances on genetics or molecular biology, where more research or more insight will be needed into diseases, and also to find a way to treat these diseases. There will still be need for biomedical scientists. And also because in the it is in the healthcare sector, there would always be need for people to carry out these tests. There will always be need for people to run tests that would enable doctors to be able to find diagnosis and treatment. So yeah, there's a future for biomedical science. So if you is something you really want to do, then I think you should just make sure you've done your research. It's something you would like to do, and just go for it, because your skills can be used in different way. It might not be in the lab, you might be in working in several sectors. So yeah, there's quite a lot you can do with your biomedical science degree. So the next question is, what industries employ biomedical scientists, or where can you work if you're trained as a biomedical scientist? So the main employer for biomedical scientists is usually the hospitals, the laboratories, the places where diagnosis is needed for treatment of diseases. So NHS is a big employer in the UK for biomedical scientists, but there are other private labs that employ people to work for them and diagnose diseases for them as biomedical scientists. Outside this, there's a public health sector where it's mainly about disease surveillance, epidemiology, like when there was COVID, biomedical scientists were quite important in carrying out the test and helping in just making sure that people are diagnosed on time. So that's another sector you could work as a biomedical scientist. The third one is clinical trials. You could be involved in working with pharmaceutical companies. They carry out tests, they carry out researches in drug testing and various fields of research. So they are biomedical scientists that can bring in the human biology side of research, and you could work in drug development and just in pharmaceutical companies as a whole. The next one would be to work in science communication. So you could probably be an editor, a medical writer. You could be like communicating online, or you could be reporting for several bodies as a biomedical scientist on several health issues. You could also work in medical sales and marketing. So we have a lot of biomedical scientists who actually are trained biomedical scientists, but they go from one hospital to the other, helping the biomedical scientists that work in the hospital to know how to use the instrument that the biomedical engineering sector has produced. So that's another way. So even if you're trained as a biomedical scientist, you don't have to work in the lab. You can work in all these sectors and your skills will still be very much put to use. The next question is, can you easily move between academia and industry and the health sector? Yes, it's easy for you to move from, maybe if you're trained in the health sector, you're working in the lab, then you want to become a lecturer or you want to move to the industry. That's the good thing about biomedical science. It's quite versatile. You could just decide to move to the industry. Your skills will be transferable across all these fields. So it is quite versatile. You could easily move. How can you stay current in the field of biomedical science? So the main thing is just to be on the lookout for new developments, new findings by reading journals, by attending conferences. There could be webinars that you could attend. Sometimes the laboratory usually carry out lunchtime lectures. There would be magazines from the IBMS. There's the internet. So there's various ways by which you could stay current in the field of biomedical science just by being on the lookout of what is going on out there. The next question is, what interview questions should I prepare for? To get a job in the NHS is quite different from getting a job in the industry. But the general interview questions will be something about behavioral questions. Usually in the NHS, they would want to know how you've handled situations. They will want to know how you carry out your test, how you troubleshoot, how you communicate with others. So it's generally questions about you as a whole, your ability to work in a team, your ability to communicate effectively, your ability to follow procedures, your ability to apply what you've learned into what you're doing. So the questions can come in any form, but the NHS uses like a star method where they will give you like a situation and ask you how you would manage the situation, or they might ask you for a scenario, how you manage it, what your weaknesses are, what your strengths are. So those are the questions that they usually ask in the NHS interview. I have a video on that if you like to go in deeper on that, on the questions I asked. But usually it's just to find out who you are as a whole and how you will fit in into their team or into the laboratory team or into the industry as a whole. Next question is, how do I make my CV stand out to employers? So the main thing is just to prove to them that you can do what you have on your CV. Highlight all your lab techniques. Make sure your abilities or your ability to perform this is stated clearly on your CV. Make sure that you've gone for placement. Make sure that you've actually had exposure to the field where you want to practice. It would be nice for you to have like laboratory experience. That is what employers are mainly looking for, because they want someone that will come and that will be ready to hit the ground running. So if you're someone that have the opportunity, or if you're someone that is thinking of getting jobs in the NHS, try and get volunteering experience. Try and do things that will make employers want them in their team. Show eagerness, show that you're able to communicate, effectively show that you actually can fit into the team. So to make your CV stand out is just by you stating what you can do, and actually when you're called for interviews to be able to communicate this effectively. So as I was saying, the next question would be in relation to how to get volunteering experience. So in the climate, in the NHS or the work climate now, it's kind of a challenge, but it's still possible. So there's usually two ways by which you can join, by which you can find experience. The first one will be for you to volunteer. You could just call laboratory managers, ask for opportunities to volunteer. Most of them might be willing, or maybe the time is not suitable. They might be able to give you a time that will be suitable for you to come in and volunteer. It might just be a day in a week, or just few hours in the week. By that, you'll be able to get the exposure into the lab, how the lab works, and you'll be able to have that exposure, which will come handy when you're applying for jobs. Then the next one will be for you to apply for bank roles. There are many NHS trusts now that are advertised for bank roles, so you might be able to come in, even though you might not be able to work as a biomedical scientist. Even if it's like an MLA, that would be you in the lab. That's a step in the door. You'll gain experience. You would know things that would expose you to the field of biomedical sciences. So when you're ready to apply for a job, all these experience that you've been able to gather, either as a volunteer or as a bank worker, would come handy. So just keep on looking for opportunities, and hopefully you'll be able to get something at the end of the day. Thank you so much for joining, everyone. Thank you. So another question is, what are the areas of specialization for biomedical science? So biomedical science is quite a broad field, but usually these categories are into four. I'm just going to read my notes so that I give you the accurate information. So there are four major ones. So the first one is infectious disease. The second one is blood sciences. Then there's cell sciences, and there's genetics and molecular biology. So for the first one, which is infectious disease, this is usually in relation to like microbiology, which involves the identification of microorganisms. Then there's virology, which is in relation to virus. So these two specialty come under the infectious sciences. So for you to, if you're interested in finding out diseases, finding out bacterial, microbiology, microorganisms, then this is a specialty for you. Then the next one is blood sciences. This is covering like clinical chemistry, which is in relation to analyzing of bodily fluids for like glucose or toxins and stuff like that. Then there's transfusion science. That one is in relation into matching blood groups. And they work in blood transfusion, making sure that the patients get the right blood to prevent any complication. Then there's hematology, which is basically in relation to the diseases of blood, maybe leukemia or any blood cancer. Then there's immunology, which is in relation to understanding the immune system and how the immune system plays its role in combating diseases. So that's the first specialty under blood sciences. The next one will be cellular sciences. This is in relation to maybe pathology, which is usually like histopathology that deals with tissue, different tissue from the body, from the skin, from the internal organs. Then there's also cytology, which is in relation to examining of cells. That's in cervical screening or thyroid smears and stuff like that. That's where cytology comes in. Then the last one, in addition to cell sciences, is mortuary. They carry out autopsy. They carry out, find out why people die or what's the cause of disease, or if there's a sudden death, and the mortuary service would come in to examine the body and carry autopsies to find out why the death has occurred. And the last area of specialty is genetics. These people are in charge of carrying out genetic testing for studying hereditary disease, maybe in relation to like thalassemia or sickle cells. These are diseases that can be passed from one generation to the other. So the genetics would come in and just carry out these tests, so they will be able to advise intending parents on the risk of continuing with a pregnancy or the risk of having a child that has a disease. And the molecular pathology are the ones that examine diseases in molecular level that would be important in the treatment of diseases. So these are the main categories for uh, biomedical science, there's cell sciences, you can work in blood sciences, you can work with tissues, you can work in molecular genetics. So there's a vast range of specialties you could go into if you're trained as a biomedical scientist. The next question is, how much does biomedical scientists earn? So to become a biomedical scientist, you would have gone through all this training. So I'm going to start from you coming out as a fully qualified biomedical scientist with your HCPC registration. So as a newly qualified biomedical scientist in Scotland, you would earn between 33,000 and 41,000. To as a biomedical scientist in England is usually lower, so that's from like 29, 30,000 to 36,000. As a specialist biomedical scientist, that means you've done your specialist portfolio and you might have like an MSc, but most importantly, you would have obtained your specialist portfolio. In Scotland, you earn like 41,000 to 50,000 per annum. Whereas in England and Wales, you probably earn about 37,000 to 44,000. To be a senior BMS, which is a band 7 in the NHS, you probably have your fellowship with the IBMS, you probably have your MSc in biomedical science or in management or any other advanced degree or leadership training as a senior. So in Scotland, you earn about 50,000 to 59,000 as a senior biomedical scientist. Whereas in England or Wales, you could earn between 46,000 and 52,000. All these figures I've just mentioned are on the NHS website, so you could check them out. And usually, if you live in London or if you live in Shetlands, I'm talking about the UK geographical area now, you would probably get a little bit more because these areas are have high cost of living, or they are so remote. If you live in Shetlands, they might give you a little bit of incentive, so it could differ, but usually this is the standard of payment that you would expect to receive as a BMS. The next question is, where can I get biomedical scientist job? So the main, as I said, in the UK, the main employers for biomedical scientists is the NHS. So the first point of looking for jobs will be the NHS website. The NHS England and Wales use the NHS job website, but for Scotland has its own separate NHS website, which is the NHS Scotland Jobs website. These two particular websites would usually have a lot of jobs which covers these areas. Then there's jobs.nscni.net. This is for jobs in Northern Ireland. So if you're qualified in the UK, you could actually use your degree to work in Northern Ireland. There's biomedical scientist job. There's career sense and new scientist job website. These are just a few of the websites that you could search for to get your biomedical scientist jobs, but just online would be a good source to get information about these jobs. The next question is, should I study biomedical science if I don't get into medical school? So this is usually a common question because it's the general conception out there that people that don't get into medicine tend to go for biomedical science. So it might be the case, but it might not be the case. Some people might want to study biomedical science just because they want to work in the health field, but they don't want to have to go through the rigorous trainings to become a medical doctor, or they don't want to have patient contact. Hi, Jupiter. Thank you so much for coming. Hi. So it depends on you. Should you study biomedical science before you go into medical school? I would say yes. If should you study biomedical science if you don't get into medical school? I would say it depends on you. So if you're really interested in diseases, in diagnosis, in research, in just working behind the scene, then I would say biomedical science is for you. If you're interested in just doing the job while the doctors do the rest, then biomedical science is for you. If you don't want to spend time in school training for so long, if you just want to be in uni for like 3-4 years and you want to start earning, you want to start having a life, then biomedical science is for you. If you're interested in research and you just want to go into the research field, in biomedical science, I would say it's for you. But if you are passionate about medicine, then I would say going through biomedical science is a completely different route for going to becoming a doctor. Even though the medicine and the um, biomedical science part might sound similar, but it's quite different. Oh, thank you so much. Yeah, thank you so much. Thank you for the comments, Jupiter. Thank you so much. So for you to consider biomedical science, make sure that is something that you really love to do. But if your goal is to become a doctor, I would encourage you to pursue your career as a medical doctor, because at the end of the day, you might complete your training as a biomedical scientist, but in your heart, you know that you want to become a doctor. So you will still feel like it's something more. It is something else you would like to pursue. Biomedical science can take you 3 or 4 years. Medicine can take you 5 years to get qualified at the university. Then you have years of training before you can become a medical doctor. So that's another 3 years or 4 years that's outside the training in the lab. So if you really want to become a doctor, it might be better for you to pursue your dream of becoming a doctor. But if you didn't get into medical school, maybe you can consider becoming a biomedical scientist. But personally, maybe in your training years, it might be best for you to train in like a field that would allow you to work outside school hours. So make sure that that's something you put into consideration, because when you're studying medicine, you might not be able to use your license to work as a biomedical science, because you might not have the time basically to work as a biomedical science. But if you're if you train like a nurse or a physician associate, these are degrees that are probably similar to medicine. You can work as a nurse while you're studying as a medical doctor, and you can work as a physician associate. But the bottom line is for you to make sure that this is what you want. If you didn't get into medical school, you can always try again. But if biomedical science is what you want, then you can go for it. But if medicine is what you want, it's better for you to keep on pursuing your goal, and hopefully you will get there one day. So that's the end of the questions I've got. Thank you so much for everyone that's joined. I hope you've been able to learn one thing or the other. But if you have any further questions, do check out my videos. Most of my videos on my channel might have answers to your questions. But if not, then you might just drop a question under any of these videos, and I'll be able to answer you when I get the questions. Or I'm on Instagram also, Ask Emily MD. That would be another channel to get in touch with me. Thank you very much for everyone that's joined, for everyone that sent a comment, for everyone that's popped in. I really appreciate your time. And that is me for now, and I'll see you in my next video. Thank you very much. Bye for now.